And the goal of our panel will be to discuss what is that role of innovation post-pandemic or even during the pandemic. Did that fast-track our development of new technologies and services to older adults, specifically around bridging gaps around labor shortages, care standards, life enhancement, safety protocol, and finally, remote monitoring. Next, we'll move to Raj Shah. He's the CEO of CareSafely, another amazing company on the absolute bleeding edge of this response that we have. And I'll let him sort of explain what he's doing.
Hi, folks. Good to be here. And thank you, AustinUp, for organizing this important conference, Teresa as well. And I'm just like you all, passionate about just seniors. And my background is really around safety. I spent the last 7 years helping the food industry stay safe in terms of E. coli, salmonella, all the different things that could affect the consumer food supply. So I wanted to, as when COVID hit, I wanted to take a step back and think about, well, how can we help seniors with safety issues, especially related to infection control. So that's what CareSafely is all about. I'm really excited to be on the panel with you guys.
Great. Yeah, Raj, and we'll get into this later, but tackling something that my facility is Georgetown Living, we're sort of now having become very familiar with the pandemic, and his technology is showing how we can start to magnify and improve on that care delivery. If we start to zoom out and look at it, sort of first question we have to address, unfortunately now, I wish we didn't, but is COVID. So I'm going to put myself in a perspective that a lot of listeners or a lot of viewers right now might be thinking about, which is I have a loved one. They're an older adult. They need care. COVID did not stop that. They're either receiving care in their home with a caregiver or unpaid caregiver, a paid caregiver, or a senior living facility. So I'm just going to throw it out to the panel. I'm that person. I'm the one who has an older adult. How are other senior living facilities out there coping with it? Home care technology or home care companies coping with it? And how does more importantly, how does your technology help improve sort of the care delivery right now that we're receiving, millions of older adults are receiving? So throw that out there to the panel.
I can go first real quick in terms of senior living in short. You know this better than anyone managing one. It's having a devastating impact if you're at a senior care facility, right? The lockdowns, the inability to see families, et cetera. And it's really, really difficult for all parties concerned. One of the things we're doing is as part of CareSafely is basically what we realized was the response has been almost heroic, but not necessarily strategic and systematic. And so we went back to the drawing table and thought about, okay, what does this organization, any organization need? Is they need a strategic way to think about all the risks related to COVID and infection control. First point, which is really make sure you understand where the risks are in your facility. It's not just about testing. Testing is just one portion of the overall picture of an organization has to think about. So what we're doing is helping senior care facilities make sure that they understand all the risks, create action plans to reduce all those risks, mitigate them or close them down completely, and continue the compliance and auditing of all the things, whether it be COVID checks, it could be PPE inventory levels, whatever it is, to make sure that we have an effective response so that we can get the families reunited with the loved ones as quickly as possible. And that's sort of a really important part for the mental health of the seniors as well as for the families to reconnect them again.
But I want to transition a little bit, Raj. I'm going to be selfish. I'm going to talk about my role as a senior living facility operator. We own dementia communities just north of Austin. This has been changing regulations between the county, the city, and the state has become this huge administrative burden now where, my team is beyond stressed out. And that's not even to deal with what the daily operations of well-being. How do you see technology, and it could be yours, it could be any, but would love to understand how you see being able to solve this compliance issue and then get back to resident care, like get back to the operations of why we do this. Like, tell me, is that a role that you see for what you do and beyond?
Yeah, definitely. If you think about the current way most senior care centers are doing this, is typically paper-based audits or checklists, spreadsheets and emails and PowerPoints to manage their entire risk control. I come from a technology world for 25, 30 years. If you think about EHR systems, we have ERP systems for manufacturing. We've been automating the workflows for 20, 30 years. And this industry needs to think about how do we fundamentally automate all these workflows, especially as it relates to infection controls, because that literally is the difference between life and death for the patients and residents and the employees themselves. So what we're working on is essentially, and we just launched a few weeks ago, is to automate that entire process. So you first start with an assessment like, okay, what are the 80 different risk areas in an assisted living facility or in a memory care facility? And we get all this content from CDC, CMS, Departments of Public Health. We aggregate all that content, and then we have an industry panel that looks at all this content and says, okay, these are the right, topics to cover from a risk area point of view. So that's the first step, is understand what exactly is going on in my facility. What are all the different things I need to think about? Not just the testing and the visitor check-in and check-out. Yes, those are important parts. There are a lot more areas that one has to think about in terms of stakeholder communications, staffing, all the different aspects of managing the response. Second is, of course, managing these risks and making sure that someone's accountable to closing these risks down. When you start doing emails and paper-based stuff, it just gets lost and everybody's super busy. What we found is about a 50% reduction in all the administrative stuff that they have to do with managing the risk control, so you can get back to caring more carefully. So that's essentially what we're essentially trying to help with, is just minimizing all the administrative paperwork and being much more comprehensive and complete and strategic about the managing of the whole risk process.
Yeah. Full disclosure, I should say this is sort of like the old school commercials where the hair club for men. Not only am I the CEO, I'm also a member. Through this panel, getting to know Raj a little bit, we've decided to deploy his solution in our community. And the sheer reason is everything he said is right. We have to do this manually. We're counting paper, which drives me nuts. I'm sort of known around town as the elder tech guy, and I'm relying on paper. And I was like, man, there's got to be a better way to do it. I could not start another company. Luckily, Raj already did it. And what it allows is that we just have this administrative and compliance burden that is really no joke. And so I think that compliance, and we'll get to this later when it comes from a labor perspective.
I came from the food industry, and over a 10-year period, food safety, because of all the things of E. coli, salmonella, all the things that were happening, consumers demanded much better regulations, much more stricter enforcement. And over that 10-year period, what happened was Congress passed the Food Safety Modernization Act. Walmart said, if you want to stock stuff on our shelves, you've got to be certified and really focus on safety, and you go through third-party certifications. I believe that's going to happen to this whole senior care industry over the next 5 years, 7 years, is we're going to have to get much more stronger about safety, about compliance, about training the workforce. I have some numbers that are just, let me throw a few numbers out at you all. If you think about these caregivers, the frontline caregivers in the industry, these folks do some amazing and incredibly hard work of taking care of seniors, right? Whether it's at home health or if it's in a facility. Really hard, literally backbreaking work. The injury rate of a senior care worker, a caregiver, is 2 times higher than working in a construction site and 2 times higher than working as a coal miner. Just think about that for a second. They're 2 times more likely to get injured on the job than working in a construction site or in a coal mine. 8 times more likely than working in an oil and gas mining or extraction industry. So we've got to do a better job as an industry in terms of both for the workers, and because they're ultimately what they do affects, of course, the resident and the patients as well. So we've got to do a better job as an industry in training these folks. And if we don't, the compliance folks will come following, whether it be from the government or other places, right? And the lawsuits have also started going up quite a bit. There's a lawsuit that just, it's about 55 lawsuits that have opened up in the last few months related to some of these issues around safety. So compliance is going to become a bigger and bigger issue, and the industry's got to get in front of it. Otherwise, it'll get steamrolled by it.
Yeah, Raj, thoughts on sort of the workforce that we have now and what the technology's role will be, and then I got a couple of audience questions I'll get to. Go.
Yeah, just adding. These are great, interesting points on that. Just one additional thought around the caregivers. So these caregivers making 12 to 15, $18 an hour, high turnover rates, right? 50, 80%. So one of the biggest challenges that COVID has created is essentially a shortage of employees, workers, right? And Shar, we've talked about this, how hard it's been to just hire new folks. one of the things we have to do from a safety and compliance point of view is make sure that the employees themselves feel very safe about working there, right? I saw an article in the Washington Post recently. It said working in a long-term facility is now the most dangerous job in America, which it shouldn't be. It just shouldn't be. We have to do better. And so I see the need for additional training, much better training than we currently have in the industry, much better ways to giving them comfort that we've got the systems and technologies in place to not just manage patient and resident safety, but also their own safety, right? We've got to give that comfort level to them, reduce their fear of getting COVID or other aspects of it. So that's the other area that we've got to think about. It is not just from the patient point of view, resident point of view, but also what do we have to do for our own employees and staff members as well to keep them safe. For the company, I mean, my goal essentially is to, and it sounds kind of bold, but it's literally to ensure that every senior is safe and every caregiver is safe and compliant, and so that and that the seniors get the full care that they deserve because the caregivers have the right training and the right procedures. Our thinking about this is basically we want to ensure that the caregivers have 100% of the knowledge to make the right decision 100% of the time. And those are really important decisions, whether it be medicines, whether it be, activities of daily living, whatever the activities they have to do, they do that with the best training and the best understanding of what they need to do. So that's our goal, is to keep everybody safe.
Yeah, and I think what we'll see for those who are in the industry, if there are anybody who are on the call, I mean, we're going to be saddled with a lot more compliance issues when it comes to any sort of infectious disease. It is a nightmare to manage. Being able to put this in the back burner, but also encourage, I'm getting back to the labor problem of encourage training, and the system prompts you, training for washing hands. How do we prove that we did that? I can't believe that that's something that now we have to think about, but it is a real problem, right? And solutions like this help us do that.